Chai, I am Dr. Sarah Collins. Before we begin, I want you to pause for just a second and really listen, because what you're about to hear is not theory, not motivation, and not something meant to scare you. It's something every adult over 40 should already know, but almost no one is ever told. Imagine this: you're standing in your home doing something ordinary, making coffee, washing dishes, tying your shoes, no pain, no warning, and then suddenly, your body doesn't obey you anymore. One arm feels heavy, like it doesn't belong to you. Words don't come out the way they should. Your balance feels wrong, but only for a moment. And then, it passes. You tell yourself it was nothing, just age, just tiredness. But what if that moment was your only early warning? What if your body whispered before it ever screamed? Today's video is about that whisper. And more importantly, it's about what to do in the first few minutes when seconds quietly decide the rest of your life. In the next few minutes, I'm going to explain exactly what happens inside the brain just before a major stroke, the early signals most people over 40 ignore, and a simple body and breath response that research shows can help protect brain tissue while help is on the way. This is not a replacement for emergency care. This is about buying time. And when it comes to the brain, time is everything. If you're over 40, over 50, or caring for someone who is, I want you to stay with me until the end. Not because this is dramatic, but because this is practical. This is about readiness. Most people think a stroke is sudden and obvious, a collapse, a blackout, but that's rarely how it starts. In many cases, the brain gives subtle warnings minutes, hours, or even days before a major event. A hand that suddenly feels clumsy, a sentence that comes out wrong, a brief wave of dizziness that disappears as quickly as it arrived. These moments are often dismissed, especially by older adults who were raised to push through discomfort and not make a fuss. But inside the brain, something very real may already be happening. Blood flow may be slowing, oxygen delivery may be dropping, and brain cells do not wait patiently. They begin to struggle within minutes. Here's the part most people never hear. In those earliest moments, before damage becomes permanent, the body still has ways to help itself. The heart, the lungs, and even gravity can work together to support blood flow to the brain if you know how to respond. But without knowledge, people do the worst possible thing. They stand up. They try to walk it off. They panic. Panic tightens blood vessels. Standing increases the risk of a fall. Waiting wastes the narrow window where intervention matters most. This video will show you how to recognize those early warning signs, how to respond safely and calmly, and how simple positioning and breathing can support circulation when it matters most. We'll also talk about why recovery is possible even after a stroke, and how daily habits starting tomorrow morning can strengthen brain circulation long before danger appears. This isn't about fear, it's about preparation. Because aging does not mean helplessness. It means awareness. And awareness gives you power. Stay with me, because what you learn here could one day protect your brain, your independence, and your future. Now let's go deeper into what those early moments really look like, because this is where most people over 40 make a dangerous mistake. When the symptoms first appear, they often don't feel dramatic. There may be no pain at all, no collapse, no obvious emergency. That's exactly why strokes are so often missed in their earliest phase. The brain is incredibly efficient at compensating, at least for a short time. When blood flow is reduced in one area, nearby vessels try to reroute supply. This compensation can make symptoms come and go, creating a false sense of safety. But that back and forth is not stability. It's a warning. Think of it like a power grid under strain. Lights may flicker before they go out completely. The flicker is not harmless. It's the system telling you it's at its limit. In the brain, those flickers can show up as a drooping face that corrects itself, a tongue that suddenly struggles to form words, or a leg that feels weak for less than a minute. Many people brush this off because it resolves quickly. But resolution does not mean recovery. It means the clock has started. One of the most overlooked warning signs is confusion that feels subtle rather than dramatic. You may know what you want to say, but the words don't line up. Or you understand speech, but responding feels slow or effortful. This is not normal aging. Normal aging may affect memory over time, but it does not suddenly scramble language. Another overlooked sign is vision changes, a shadow, a blur, a brief loss of vision in one eye that returns. People often blame their glasses, lighting, or fatigue. But the eyes are an extension of the brain. When vision changes suddenly, it often means blood flow has changed. Balance issues are another red flag. Feeling dizzy after standing up quickly can be common, but sudden dizziness while sitting or standing still is different. That kind of dizziness suggests the brain is not getting steady oxygen. And here's what makes this especially dangerous. Many seniors try to steady themselves by walking. That increases fall risk at the exact moment the brain needs stability. Falls during stroke events are a major cause of additional injury. This is why immediate response matters so much. The goal in these early moments is not diagnosis, it's protection. Protecting the brain means protecting blood flow, and the simplest way to do that is to change your relationship with gravity. When you lie flat and elevate your legs, you reduce the effort required for blood to return to the heart. When blood returns more efficiently to the heart, it can be pumped upward to the brain with less strain. This is basic physiology, but it's rarely explained outside medical settings. Breathing plays an equally important role. Shallow, rapid breathing lowers carbon dioxide levels too quickly, which can actually constrict blood vessels in the brain. Slow, controlled breathing does the opposite. It stabilizes blood pressure, improves oxygen exchange, and keeps the nervous system from spiraling into panic. Panic is not just emotional, it is physical, and it directly worsens circulation. These early actions do not cure a stroke. They do something just as important. They buy time. They help preserve brain tissue until emergency care arrives. And that preserved tissue can mean the difference between full recovery and lifelong disability. In the next part, we'll break down exactly how to perform this response correctly and why consistency and calm matter more than strength or speed. Now let's walk through the response itself, step by step, exactly as it should happen in real life. Because in a critical moment, simplicity matters more than anything else. When early warning signs appear, the brain is already under stress. Complex instructions fail under stress. Clear, repeatable actions succeed. The goal is not to do something heroic. The goal is to do something correct. The very first priority is safety. The moment you notice sudden weakness, slurred speech, facial drooping, unexplained dizziness, or confusion, stop what you are doing. Do not try to finish the task. Do not test your strength. Do not walk it off. Sit down immediately. If you are already standing, sitting prevents a fall. If you are able to lie down safely, do so. The ideal position is lying flat on your back, on a bed or the floor. Once you are lying down, elevate your legs. About 12 inches is enough. Pillows, cushions, a folded blanket, or even a chair placed under the legs can work. This position shifts pooled blood from the legs back toward the chest. When the heart has easier access to returning blood, it can maintain more stable circulation to the brain. You are not forcing blood upward. You are removing resistance. That distinction matters. Now comes the breathing. And this is where many people rush or overcomplicate things. The breathing pattern must be slow and deliberate. Breathe in gently through your nose for 4 seconds. Do not gasp. Just a smooth, calm inhale. Hold that breath for 2 seconds. Then exhale slowly through your mouth for 6 seconds. The long exhale is especially important. It tells the nervous system that there is no immediate threat, which helps prevent blood vessel constriction. Repeat this pattern steadily. As you breathe, focus only on the rhythm, not the symptoms. not fear, just the count. This does two powerful things at the same time. It improves oxygen delivery, and it keeps your mind clear enough to communicate. If someone is with you, this is the moment they should call emergency services. If you are alone and able to speak, call for help as soon as you are safely positioned. If speech is difficult, stay still and continue breathing until help arrives. One important warning: do not eat or drink during this time. Swallowing can be impaired during a stroke, even if it doesn't feel that way. Choking risk increases, and fluids will not help circulation in this moment. Position and breathing are the priority. This response does not stop a stroke. It does not dissolve a clot. What it does is protect the brain during the most fragile window. Brain cells are extremely sensitive to oxygen loss. Every minute without adequate blood flow increases the risk of permanent injury. By supporting circulation and reducing stress responses, you give those cells a better chance of surviving until medical treatment can begin. What's often overlooked is the psychological effect of having a plan. When people know exactly what to do, panic decreases, and reduced panic directly improves outcomes. Calm breathing keeps oxygen levels higher. Stillness prevents falls. Proper positioning supports circulation. These are not small details. They work together. In the next part, we'll talk about what happens after those first critical minutes, why recovery is often more possible than people think, and how the brain can rebuild when it's given the right signals. Once emergency care begins, many people believe the outcome is already fixed. Either you recover quickly or you don't. But that belief is outdated and, in many cases, wrong. The brain is not a fragile machine that breaks once and never works again. It is adaptive, it is responsive, and even after a stroke, it is constantly looking for ways to reroute, reconnect, and rebuild. This ability is called neuroplasticity, and it is one of the most important reasons hope should never be abandoned after a stroke event. When a stroke damages one area of the brain, the functions controlled by that area may weaken or disappear. Speech may slow, balance may feel unstable, a hand may not cooperate the way it used to, but the brain does not simply shut those functions down permanently. Other areas can learn to take over, especially when they are encouraged early and consistently. Think of it like a city after a road closure. Traffic doesn't stop forever. It finds new routes. At first, those routes are awkward and slow. Over time, they become stronger and more efficient. The first 48 hours after a stroke are critical, but recovery does not stop there. In fact, some of the most meaningful improvements happen weeks and even months later. What matters most is not intensity, but consistency. Small, gentle actions performed regularly send a powerful message to the brain. They say, this pathway is still needed. Rebuild it. Strengthen it. Movement is one of those signals. Even simple movements, like slowly opening and closing the hand, lifting the foot while seated, or turning the head gently from side to side, stimulate brain activity. Visualization matters too. Even imagining movement activates many of the same brain regions as physical motion. This is why people who remain mentally engaged in recovery often regain function faster than those who withdraw and wait passively. Breathing continues to matter during recovery as well. Slow, rhythmic breathing improves oxygen delivery and reduces stress hormones that interfere with healing. Stress is not just emotional. It has a direct biological impact on blood vessels and inflammation. A calm nervous system creates a better environment for repair. Nutrition also plays a role that is often underestimated. After 40 and especially after 60, what you eat directly affects blood flow, inflammation, and brain health. Foods rich in omega-3 fatty acids, antioxidants, and natural nitrates support circulation and vessel flexibility. These nutrients help blood move more freely through damaged or vulnerable areas. Recovery is not just about therapy sessions. It's about how you fuel your body every day. One of the most encouraging findings from recent research is that recovery does not require expensive equipment or extreme effort. It requires intention. A few focused minutes, repeated daily, are more powerful than occasional long sessions followed by inactivity. The brain responds to repetition. It learns through consistency. Perhaps the most important part of recovery is mindset. Many people over 40 grew up believing decline is inevitable. That belief alone can limit recovery. The brain listens to expectations. When effort stops, adaptation slows. When effort continues, even gently, the brain keeps trying. In the final part, we'll shift from recovery to prevention and talk about how daily habits can protect brain circulation long before a crisis ever appears. Now let's talk about prevention, because the strongest protection for the brain doesn't begin in an emergency room. It begins in ordinary moments, repeated every single day. Long before a stroke ever occurs, circulation patterns are being shaped by how you move, how you breathe, how you rest, and how you manage stress. The goal is not perfection. The goal is consistency. One of the most effective habits for adults over 40 is something simple that happens in the first minutes after waking. When you sleep, blood flow slows and pools in the lower body. Standing up suddenly without reactivating circulation can stress the cardiovascular system and the brain. A gentle morning activation helps reverse that. Before you even stand, sit on the edge of the bed. Take 3 slow, deep breaths, filling your lungs fully and exhaling completely. This wakes up oxygen delivery and signals the nervous system that it's safe to increase circulation. Next, begin gently pumping your calves by lifting your heels and toes in a steady rhythm for about a minute. This movement activates the soleus muscle, often called the body's second heart, because it helps push blood back toward the heart and brain. This simple action improves circulation without strain. Then, slowly roll your shoulders and gently turn your head side to side. These movements prepare blood vessels and reduce morning stiffness that can restrict flow. Hydration matters as well. Drinking a glass of water before coffee helps blood maintain proper volume and flow. Even mild dehydration thickens blood, making circulation less efficient. Over time, that inefficiency adds up. Small daily choices compound. Sleep is another pillar of prevention. Poor sleep increases inflammation and blood pressure, both of which strain the brain's blood supply. Deep, regular sleep allows blood vessels to recover and remain flexible. Emotional health matters too. Chronic stress tightens blood vessels and disrupts circulation. Calm, connection, laughter, and time in natural light do the opposite. They help vessels relax and open, supporting steady blood flow. What's important to understand is that prevention is not about avoiding life. It's about supporting the body so it can handle life's stresses. Walking, gentle movement, breathing, nourishing food, and emotional calm are not luxuries. They are maintenance for the brain. Let's return to the core message. If warning signs ever appear, do not ignore them. Do not test them. Do not minimize them. Lie down. Elevate your legs. Breathe slowly and deliberately. Let gravity help you while emergency care is on the way. Preparation turns fear into action. Action preserves brain tissue. Aging does not mean inevitable decline. It means you have more information, more awareness, and more opportunity to protect what matters. Knowledge gives you readiness. Readiness gives you power. And power, in this case, means the ability to respond calmly and correctly when seconds matter. If you've listened this far, share this knowledge with someone you care about. A parent, a partner, a friend. Practice the response mentally. Make it familiar. Because in a critical moment, instinct takes over. And when your instinct is trained, your response can be life-changing. Stay calm. Stay aware. Your body is always communicating with you. Learning to listen may be the most powerful health decision you ever make.